This is Patricia. She's having some lower back pain today and some neck pain and some hip pain. She was having some difficulty raising her right knee up when in a standing position. Felt a little restricted and imbalanced. So we're going to go ahead and check the auricular points. This area here represents the head. Here's the cervical spine, going into the thoracic spine, and then coming into the lumbar spine. And then the only thing anatomically different from all of that is that it goes C1 through 5, 6, 7, stellate ganglion, T1, all the way down to T12, and then it jumps to L5, L4, L3, L2, L1 possibly. All right, so we're gonna go ahead and feel on the neck one, and she's gonna tell me if there's any tenderness, and I'm looking for blanching. Any tenderness in there?
Yes.
Yes. Yeah, and you can see when I rolled across that, look at how that skin blanches like that. So there's a problem right there in that one. So we're gonna do a needle right there. The next point is stellate that I want to check. That would be right around C7T1. That can be exquisitely painful for those people with chronic shoulder problems. And anything there, Patricia?
No.
Okay, good. And we come through here and go towards the thoracic lumbar area, and that looks pretty good. I don't see any evidence of blanching at all. And then we're going to go towards that L5 area.
Yeah.
And that one hurts. A little jump response there. And I'm going to do it one more time just so I can show you the blanching right there. So let's see if there's anything at L4. Maybe a titch of blanching there. And then no blanching whatsoever coming in through that L3 and L2. And there's not sure if L1 is really included on that part according to Nogier. So now, as we look at that, you'll see that the triangular fossa here, very hyperemic, and that area for lumbar spine, that lower lumbar spine, is still staying very blanched, as well as that cervical region still looks blanched. Now we're going to go over to the other side. And because her pain is midline in her lower back, we're going to check both sides. She tends to have trouble with the right side on different areas. So here's the head again, here's the cervical spine coming up, stellate ganglion right in here, thoracic spine coming up, and then lumbars 5, 4, 3, 2, possibly 1 right there. So as we go through, how does the cervical region feel?
Fine.
Okay, anything getting sore there?
No.
Okay. And then as we come over towards stellate?
No.
No, okay. And we go through the thoracic spine, anything bothering you through there?
No.
Okay, and then we're getting towards that L5. What do you think?
Not bad like the other side.
Not like the other side,
I mean,
okay.
it is a little tender, but not bad like the other side.
Let's see how much it blanches. Yeah, see, we don't get quite the blanch response. And then anything at L4, 3, nothing through there. Okay,
Yeah.
And then she told me it was had some trouble out in that hip, as we talked about. So I'm going to go ahead and just check. And what I'm usually feeling for is see if there's any little grain of rice feel there. And I'm actually feeling some.
Right there.
There, okay. So we're going to go ahead and do some work right there. And that area stayed very blanched. In fact, 2 areas stayed pretty blanched right there. So let me go back on the second area and see if it's very tender. What do you think?
It's a little tender.
A little tender.
But not very.
Okay. So we'll just stick with that first point that looks like that. Okay, I'm going to stop the film.